Will almost certainly become the first country in Europe to introduce a minimum price for alcohol. The SNP government thinks it's the best way to tackle the serious criminal, social and health problems associated with alcohol abuse. It means that cheap, strong drink will become more expensive. It's the same policy that was rejected by the Scottish Parliament last year. Raymond Buchanan reports.
So this video is based on demerit goods and specifically focused on alcohol, but it's looking at how the Scottish government have intervened to try to tackle the negative externalities associated with the overconsumption of alcohol. And the intervention method that we're going to be discussing is minimum pricing and a price floor that the government has in 2018 introduced. So what we're going to be looking at is, to begin with, why did the Scottish Government decide to act? How exactly the minimum pricing works. We're going to obviously consider the diagram, and we're going to be looking at the consequences. So to begin with, let's have a look at data based on alcohol consumption in Scotland. So to begin with, we're going to be looking at off-trade alcohol sales. So what I mean with regards to that is we're going to be focusing on the likes of supermarkets and off-licences and the retailers that are going to be mostly hit by these minimum prices in Scotland. And the reason being is because when we think about clubs, when we think about bars, pubs, when we think about restaurants, they're often already selling it at a higher price with a greater profit markup because they're aware that customers will pay the higher prices because there's so much more to buying alcohol in those places than simply just the alcohol itself, and usually it's the social interaction and so on. So therefore, actually, the minimum price is not going to be massively impacting them. But when we think about, for example, supermarkets, supermarkets can buy in bulk, they can negotiate bulk discounts, they can pass that cost saving onto the customer, and what's happening is that we've got alcohol which is being sold at a very, very low price and often high percentage bottles of alcohol as well. And that's where the problems lie. Now, with regards to the introduction in 2018, you could argue, especially in the last year with the pandemic, it's hard to really assess the success of this policy. Many doctors and the NHS in Scotland are saying that early signs are promising, and it suggests that we are seeing a reduction in alcohol sales and a reduction in admissions to hospital, which is associated with alcohol. But when we have a look at this data here, we can see that the gap between Scotland and England and Wales is starting to narrow, and that's quite key because Scotland, the first ever country to bring in this minimum pricing, Wales have just brought it in, and England have rejected it. So it'll be interesting to see those price comparisons, the sales comparisons, and again to see, with regards to the NHS, how the data might differ between England and Scotland in the coming years. Now, before this was introduced, just to kind of put it into context as to why Scotland did tackle it this way, as you can see there, and this goes up to 2014, but Scotland had much higher alcohol-related deaths compared to the rest of the UK with regards to Northern Ireland, Wales and England. And therefore, obviously, Nicola Sturgeon and the Scottish Government decided it was really important for them to intervene and to try and tackle it. And there's going to be a range of different policies that are introduced, but in this video specifically, we're going to be looking at minimum pricing and price floors. We've seen some of the data as to why it was a problem with regards to deaths. Let's delve into that a little bit more. So obviously the overconsumption of alcohol is going to heavily impact the consumer, and the consumer is it might obviously change their behaviour, it might create antisocial behaviour, it might make them act completely out of character, it might lead to accidents in terms of short-term maybe NHS treatment, it might, if it's over a long period of time, and for example alcoholics, it might lead to liver disease. So it is going to obviously impact the customer, but it's also going to impact society. And what we have to remember is the social benefit attached to this is obviously going to be lower than the marginal private benefits, and that's where the problem lies with the negative externalities, because the spillover effect is negative for society, and there's greater social costs. So, as to why, first of all, let's think about violence and let's think about crime. So, 59% of violent crime in Scotland, the victim said the offender was under the influence of alcohol. So, obviously, there's a crime. There's a lot of crime which is associated with that of alcohol, and we have to think about, for example, the victim of the crime, but we also have to think about the police service involved as well. If we're doing it from a viewpoint of government allocation of resources, and we think about the police service, and we think about in terms of how much funding they receive, if they're having to use some of that funding on maybe police criminal cases which could have been avoided if alcohol was tackled, then that again frees up possibly some funding, which therefore they can be allocated on other factors. Again, when we're thinking about criminal activities, we can think about drink driving, and we can think about road deaths. So being impaired by alcohol in Scotland was thought to be a contributory factor of 13% of pedestrian road deaths. So again, that's a real problem with regards to trying to prevent that, trying to reduce that, and trying to stop, obviously, those deaths from taking place. Now, for 16 to 24-year-olds in Scotland, 32% of deaths were in males. So clearly, when we're looking at demographics and we're looking at gender, that could be definitely something to look at. 6% of deaths in females, and again, related to, obviously, alcohol. Now, another factor we need to think about is in terms of when we're looking at death, and we're looking at hospital admissions. If we've got statistics on average 22 people dying of alcohol-related illnesses every week, clearly that's horrible news for their friends, their family. But again, if we look at it from the point of view of the NHS, and we have to think about, obviously, the treatment that's required, the hospital beds that are required, the funding. And again, we have to remember the NHS get a set budget, and that the allocation of those resources are obviously very, very precious for the NHS because of the pressure that they experience every year. And if some of these illnesses and alcohol-related diseases can be avoided, then clearly that's going to free up those resources, and that means that there's going to be more hospital beds. It means that less funding will be needed based on these specific types of illnesses, or again, it could be related to short-term accidents. So when we're looking at the cost to the NHS and cost to other government services involved, such as social care and the justice system, and we can see here the figures that we're talking about: 3.6 billion each year, which includes 267 million to the NHS, 209 million to the social care service, and 727 million to the justice system. So what we're going to do now is we're going to delve into not only why it's needed, but how they're exactly going to do it.
Mo and his customers, some of them, are about to become unwitting participants in an unprecedented national experiment that the government says will save lives. In a world's first, alcohol will have a minimum price, 50p per unit. A 3-litre bottle of strong cider here will almost triple in price. A 1-litre bottle of vodka will cost less than £1 more, but a bottle of wine for a fiver will stay the same. Now, this bottle of cider costs just £4, and there are more units of alcohol in here than it's recommended you drink in an entire week. And this is the end of the market that minimum pricing wants to affect. But it will only work if enough people who come in here to buy these and similar drinks cut down considerably, rather than simply moving on to drink something else. A key question for minimum pricing is whether it unfairly penalises the worst off. We asked Nicola Sturgeon when she last spent under 50p per unit.
I tend to drink wine when I drink at all, and the wine I will drink will tend, as will be the case for most moderate drinkers, will be above the 50 pence per unit level.
I just wonder if first of all you accept that lower income earners drink the same amount as middle and high income earners. There's no discrepancy there.
Well, you're talking in generalities here. Problem drinkers are the drinkers that will be most impacted by minimum pricing. This is a carefully thought out policy. It's one with evidence behind it, and most importantly, it's one that is going to reduce deaths from alcohol and reduce the damage that alcohol does.
So if we consider the table on the left, what we can look at is the changes in price for some of the products that were targeted from the minimum price. So Frosty Jack Whites is probably the most significant, because what we can see is £3.99 was its current price, or the price just before, and then what we can see is the new minimum price in 2018 was £11.25. That's roughly 182% increase in that price, and it equates to an extra cost annually of £377.52. So that's a massive change in price, but we can see here the volume strength 3 litres at 7.5%. So clearly that's the reason it's been targeted. And Nicola Sturgeon did say that she strategically selected these drinks because they believe that the high risk drinkers, who they're trying to tackle in terms of the health impacts and possibly the criminal activity, but those who drink in significantly in excess of what is recommended, they are targeting the cheaper drinks, and therefore the cheaper drinks need to be tackled in terms of the price. But if we think about, for example, the red wine, that's only changed from £4.39 to £4.90, so an extra yearly cost of £26.52, but it's 750ml bottle. Yes, it's at 13%, but if we compare 3 litres to 750ml, we can understand the differences. Now, if we have a look at the impact of this, and I'll delve into some further statistics later, but we can see that cider did fall by 18.6%. Now, cider is looking at all different types of cider products, so I can't just base it alone on the 182% increase in price for that one cider product, but we can probably look at these products, if it's cider, spirits or beer, probably still being quite price inelastic with regards to price elasticity of demand. And therefore, it does clearly impact on the price elasticity of demand. The more elastic it is, the greater the impact will be, because we'll see that price have a massive change in customer behaviour, and that quantity demanded will fall. If it's inelastic, then we're not going to see the impact that we're hoping for. But we also have to consider cross-price elasticity of demand as well. I mean, we can see that fortified wine has gone up by 16.4%. So clearly that suggests that those who were buying cider before, they're now thinking, okay, that's too expensive. What can I switch it to? Can I switch to a substitute good, such as, for example, wine, which is seeing a smaller change in price? Now, it would be unrealistic to think that those who have maybe an addictive personality, perhaps they're alcoholics, or they're just deciding they're still going to buy it, to completely, for example, give up on these types of products. So the likelihood of them switching is quite high. But if we consider it from a positive viewpoint, they are switching to drinks which are potentially obviously less harmful with regards to what they were drinking previously. So these cider bottles, 3 litres, and then might be switching to, for example, a 750ml bottle of wine instead. And therefore they are slightly reducing their consumption. It's still obviously problematic, but I don't think the NHS Scotland expected instant results which would completely correct the negative externality. It is going to be a gradual change, and again I'll delve into some of the forecasts from NHS Scotland in terms of how they think the market will react and how it will start to correct those negative externalities. But before I do that, I just wanted to show you a video a year after it was introduced and some of the findings.
From having the first official data on the impact of minimum unit pricing, and that will give us a sense of how much alcohol is being sold in Scotland per adult, and give us a comparison to England and Wales, and that's really crucial to help us to understand whether minimum unit pricing is having an effect. The pocket money prices of some of the high-strength ciders meant that people could exceed the Chief Medical Officer's guidelines for the price of a cup of coffee, and that was just unacceptable. What minimum price has done has meant that those really cheap drinks have now effectively tripled in price, and we see people just aren't choosing to buy them anymore. People, for example, are moving from high-strength ciders to lower-strength beers. The important question is, are they drinking a bit less? Because that's the expected effect, and that's what will make the difference. So
what I do now is have a look at the diagram. Now, clearly, when you're looking at the demerit good and you're looking at the negative externalities attached with, for example, alcohol, you're going to draw a negative externalities diagram, and you're going to base it on consumption because it's the consumption of alcohol, and you're going to make it so marginal private benefits are higher than the marginal social benefits. But when we're delving at the intervention, and we're looking at this very specific method of a price floor or a minimum price, then it's a different diagram. So what we're going to look at is, for example, that bottle of cider. Now, that is the current market equilibrium, and the government obviously see this as being too low, and that's where the problem lies. It's being overconsumed and it's causing these problems. So what they want to do is they want to kind of pretty much fix the price and take out the laws of this market equilibrium with regards to supply, meeting demand, and they want to bring in a price at this point here, let's say, and this is higher than the market equilibrium price because what they're looking for is a change in the quantity demanded, and because it's a price change, it'll be a movement along the demand curve. So what we'll see is we'll see a contraction of demand from where obviously the market equilibrium is at Q1 to now that new point of Q2. So hopefully, and again, this demand curve, I haven't really delved into price elasticity, but you could do that. But what we can see is the quantity of this alcohol has reduced. Now, you can also look at it from the supplier's point of view, and you can definitely analyse as to whether this is realistic or not, and it could be just a theoretical argument. But you do also have to have a look at the profit incentive, for suppliers. If price rises, we're taught that the suppliers should react and should be more responsive and want to obviously supply more if they can. Now, that means that there'll be an extension of supply and there'll be a movement up the curve, and that should therefore lead to Q3. And you might look at, well, why are they going to supply more if there's going to be a contraction of demand? And I suppose in reality, some of these producers, they'll have carried out market research. They'll be quite savvy in terms of they will forecast the reaction from customers as to what they believe let's say the price elasticity of demand will be, and they'll obviously adapt based on that. But theoretically, if we're looking at this diagram, if there is an extension of supply, then clearly now we've got excess supply of Q2 to Q3. And that can be problematic for producers. Now, just to go over what a price floor is again, or a minimum price, it's simply, as I said before, it's fixing it above the equilibrium price. So it's making it legally the lowest amount the product can be sold for, because it's a government intervention, it's that legislation. Now, with regards to this specific example, this was a minimum unit price, so it's looking at a single unit of alcohol, and it was 50p based on that single unit. Now, if we're looking at some of the statistics and we're looking at some of the data, we've obviously seen the video from a year on, so that was in 2019. But let's just have a little look again at Scotland and some of the statistics that were found from the NHS. So pure alcohol drinks sold in Scotland was 9.9 litres per adult in 2019, which was down from 3% from 2017. So there's a slight change in that. 2010, the volume of pure alcohol sold per adult through supermarkets and off-licensing had fallen by 9%. And you have to remember again, I'll repeat myself here, supermarkets and off-licensing, they're the ones that are going to be targeted because they're the ones that offer the best price reductions. They're the ones that can buy in bulk, and therefore they can sell for lower prices. Whilst we've got restaurants and bars and clubs that do tend to sell at with a higher profit margin, and therefore they probably won't be impacted as much by that minimum price. Now, what's also interesting to see is in England and Wales over the same period, it actually increased by 3%. So again, it'll be fascinating to see what happens in Wales next, and it'll be also fascinating to see what continues to happen in Scotland, and if it does, and we see that trend. Now, as I said, it's a gradual process. The NHS are not expecting instant results, and what they have predicted that in the first 20 years, the policy was estimated to result in 2,036 fewer deaths and 38,859 fewer hospital admissions. Okay, so it'll be interesting to see if it has helped the NHS. and it has helped to reduce that negative externality. Now, in the UK, it was rejected in 2013, and lots of reasons. There was arguments that it was regressive and it was going to punish the lower income. It was going to punish, again, the moderate drinkers, and it just wasn't a very popular policy. So I'm just going to show you a quick video again based on what happened in 2013 and as to why it might have been rejected.
I think this minimum unit pricing is a big part of the answer.
So said David Cameron last year. But when it comes to tackling cheap booze in England and Wales, it seems he doesn't have the support he thought he had.
Mr. Speaker, in the light of his U-turn on alcohol pricing, can the Prime Minister tell us, is there anything he could organise in a brewery?
The Prime Minister chose to avoid answering that, but with claims the government's ditched plans for a base price of 45p per unit, he couldn't ignore a question from a former GP.
Whenever alcohol is too cheap, more people die. Will he meet with me for me to urge him and for him to understand the evidence base behind minimum pricing?
We publish proposals, we're looking at the consultation and the results to those proposals, but be in no doubt we've got to deal with the problem of having 20p or 25p cans of lager available in supermarkets. It's got to change.
So a pledge to stop cheap booze being sold, but no real commitment from the Prime Minister to a minimum unit price on alcohol. Even the Cabinet appears split.
It's normal for Cabinet members to have different views on different things. That's what happens when you sit around a table and discuss the way forward. But what everyone wants to do is to look at the Home Office consultation.
The industry hopes that consultation will be used as an excuse to kill legislation.
There's no evidence it would work in the real world, and indeed we think the heaviest drinkers are least responsive to price.
But doctors say they need assurances.
We need to know that this is going to go ahead because we have to deal as doctors with the tragedy that we see from people who are themselves dying, but equally the tragedy for their families.
Cheap alcohol is often blamed for turning our streets into this. Scotland has already passed legislation for minimum pricing, but because of legal wrangles in the courts, it's yet to be introduced. Another reason why the government here can sit back and wait, even if David Cameron would rather not. Alex Forrest, ITV News.